No, every patient should not labor down when they get to 10 centimeters. And let's talk about what laboring down means. Now, laboring down is also referred to as delayed pushing or passive descent. And that just means once the patient gets to completely dilated, whatever centimeter that may be, because it's not 10 centimeters for everyone, but there's no more cervix, then that would mean that there is a period of time where there is no pushing and the forces of the uterine contractions and work to push the baby down the pelvis and do the rotational maneuvers that need to be done to facilitate descent into the pelvis of the fetal head and potentially shorten the second stage of labor, which is when the patient is actually pushing. Now, some people, no matter even if they wanted to, could not delay pushing because the urge they have is so strong that they have to push. And telling them not to is not a very nice thing to do. For others, when they get to complete dilation, the fetal head may be still high in the pelvis. So laboring down for a half an hour to an hour may be in their best interest, as long as they are not feeling that urge to push. Now, I work where there's continuous external fetal monitoring. So laboring down is also dependent on the status of the fetal heart tracing. As long as it's reassuring and the patient wants to labor down and they feel like they can and there's an indication to, no problem. Now, there's no recommended time limit for laboring down and someone who is a good candidate for it. But personally, I like that 30-minute mark, sometimes an hour, but nothing beyond that. Did you labor down or do delayed pushing? Tell me about it in the comments. Now, I'm going to tag another video on this topic by one of my besties, Dr. Fatima Daoud, that gives you some more scientific data on this topic. So watch her video as well.